You know that moment when you're petting your cat, just stroking their chin, and you feel, I don't know, a few little black specks or maybe some tiny bumps?
Uh-huh. Or you've seen it and just sort of wondered, what is that?
Exactly. Well, today we're going to plunge right into something super common in cats,
Yeah.
something you've maybe encountered but haven't, fully grasped.
That's right. We are doing a deep dive today into feline acne.
Feline acne. Okay.
Yeah, it's a term you might have heard thrown around, but we're aiming to go way beyond just a quick search result here.
Right.
We're actually digging into a pretty comprehensive veterinary overview on the condition. So this isn't just guesswork. It's based on established vet knowledge.
Good.
Okay.
Okay. So our mission today is basically to break down what feline acne actually is and, importantly, what might cause it, because apparently it's not always straightforward.
Not always, no.
And then how vets figure out if it is acne or something else, and crucially, what can actually be done about it, all in a way that's, easy to follow.
Let's do it.
Okay, so let's start with the absolute basics. In simple terms, what are we talking about with feline acne?
Okay, so in essence, feline acne is a type of skin inflammation, a dermatitis technically.
Yeah.
And it specifically hits the chin area and sometimes the lips too.
Chin and lips. Got it.
Now, a really key thing to get is how variable it is, like hugely variable.
How so?
Well, for some cats, it might be a one-off thing. It pops up, gets treated, never seen again.
Okay.
For others, though, it can be this recurring problem, flaring up now and then throughout their life.
Ah, so it comes and goes.
Or sometimes, unfortunately, it can become this persistent chronic condition that just sticks around.
Wow, okay. So it's not just how often it happens, but I guess how bad it gets can vary too.
Precisely. The severity can be totally different from one cat to the next.
Yeah.
And even in the same cat, one flare-up might be mild and the next one could be, much more significant. It really fluctuates.
Okay, that's good to know. So if you're sitting there wondering if your cat might have this, what are the actual signs? What would you physically see on their chin or lips?
Right. So often the very first things people tend to notice are what vets call comedones. Think of them basically as tiny blackheads.
Blackheads, okay. Like people get.
Kind of, yeah.
Yeah.
Just on the cat's chin. You might also spot some slightly reddish, raised bumps. Those are called erythematous papules.
Papules, right.
And sometimes there's a bit of crusty stuff, almost like dried fluid. We call those serous crusts.
Okay.
And you might see some dark, sort of gritty-looking debris mixed in there. That's usually keratin, just built-up skin protein.
And this is mostly on the chin.
Mostly chin, yeah, but definitely can show up on the lips sometimes too.
Okay, those initial signs, they sound relatively minor, I guess. But you mentioned severity varies. It can get worse than just blackheads and little bumps.
Oh, absolutely, yeah. In more advanced or severe cases, the chin itself might actually look swollen.
Swollen.
Yeah. And instead of small bumps, you can see larger lumps develop. Those are called nodules. The crusts might look kind of bloody, hemorrhagic crusts.
Mm.
You might even see actual pus-filled bumps, which are pustules. Sometimes deeper fluid-filled sacs called cysts can form.
Cysts too, wow.
And in really tough cases, you might see draining tracts, little openings, oozing stuff, sometimes called fistulae. The skin can get really red, severe erythema. You might see hair loss in that area,
Yeah.
alopecia.
Hair loss, okay.
And yeah, the area can definitely become tender or even properly painful for the cat,
Yeah.
especially if a secondary bacterial infection jumps in.
Ouch, yeah, that sounds genuinely uncomfortable. So what's actually causing all this inflammation and, well, mess? What's the root cause?
Yeah, this is where it gets kind of fascinating, actually.
Oh,
The exact cause, the single trigger for feline acne, it isn't fully understood.
really? For something so common?
It might be surprising. Right? We don't have one definitive answer.
So it's still a bit of a puzzle for vets then?
In some ways, yes. But we do have a list of potential contributing factors, things that researchers think play a role.
Okay, like what?
Well, one idea is that there's a problem with how the skin cells produce keratin, that skin protein we mentioned, like a disorder of keratinization.
Hmm.
Poor self-grooming habits could maybe contribute in some cats. Or, the opposite problem, maybe an overproduction of skin oil, which is called abnormal sebum production.
Okay, skin oil. Makes sense.
Then there are theories about the immune system maybe being a bit suppressed or weakened, immunosuppression. Certain viral infections have been looked at. Even stress is considered a potential factor.
Stress, yeah.
Yeah. But the most likely scenario, honestly, It's probably not just one single thing. It's more likely a combination of several of these factors interacting in an individual cat.
Right, a perfect storm kind of situation for that particular cat's skin.
Exactly.
Okay, so if it could be a mix of things and the signs can vary, how does someone know for sure it is feline acne they're dealing with and not something else that just looks similar?
That's a really critical point. Because yes, there are definitely other conditions that can mimic feline acne. That's why getting your vet involved for a proper diagnosis is so, so important. You can't just assume.
Okay, so what else to be mistaken for?
Well, for example, a straightforward bacterial infection just in the hair follicles, that's called bacterial folliculitis, can look very much like it.
Right.
Then there are tiny skin mites, demodex mites. They cause a condition called demodicosis, which can also present on the chin.
Mites.
Yeast
Oh.
infections, too, specifically with a yeast called Malassezia, that can cause inflammation and crusting. Even ringworm, which is actually a fungus, not a worm.
Yeah, dermatophytosis.
Exactly, dermatophytosis. Sometimes that can look similar on the skin.
Wow, okay, that's already quite a list. Anything else?
Afraid so. Sometimes, though less commonly, certain types of tumors involving the skin glands, the sebaceous or apocrine glands, could be mistaken for acne initially.
Tumor. Okay, that's more serious.
It can be, yeah. Then there's another inflammatory condition cats get called eosinophilic granuloma, and even simple contact allergies. Maybe the cat's reacting to their plastic food bowl, for instance. Contact hypersensitivity.
Gosh, so it really requires some detective work.
It really does.
Mm.
A vet needs to systematically rule these other possibilities out.
Okay, so how do they do that? How does a vet actually diagnose feline acne and differentiate it from, well, all those other things? What tests are involved?
Well, interestingly, the standard stuff like routine blood work, a CBC or chemistry panel, or even a urine test, they usually aren't very helpful for diagnosing the acne itself.
Oh, okay, so it's not in the blood.
Not typically, no.
Yeah.
The focus really has to be directly on the skin lesions on the chin and lips, examining those closely.
So more hands-on skin investigation then.
Exactly. A really common first step is a skin scraping. The vet gently scrapes the skin surface to collect a sample,
Mm-hmm.
and then they look at that under the microscope, specifically searching for those demodex mites we mentioned.
Ah, checking for mites.
They might also do a fungal culture, taking a sample, often some hairs or crusts, and trying to grow fungus from it in the lab to rule out ringworm.
Okay.
And another super useful tool is cytology.
Cytology, what's that involve?
That's where they collect cells directly from the lesions, maybe by pressing a microscope slide onto the affected area or using a very fine needle to suck up a few cells that's a fine needle aspirate.
Okay.
Then they stain those cells and examine them under the microscope to look for bacteria or yeast cells, and also just to see what kind of inflammatory cells are present.
Gotcha. What about biopsies? Are those common?
Biopsies, where they take a small piece of skin tissue for analysis, aren't needed routinely for typical acne cases,
Mm.
but they can be really valuable in more complicated, severe, or unusual cases.
Why is that?
Well, the biopsy gives a pathologist a much more detailed look at the structure of the skin, the hair follicles, the inflammation. It can definitively rule out other diseases, like certain immune conditions or even cancer, and confirm the pattern seen in acne.
That makes sense. So speaking of what's seen under the microscope, what is actually happening down at that microscopic level in a cat with feline acne? What would that pathologist see?
Right, so in the milder cases, the main thing you see is that the hair follicles get kind of stretched out and plug up with keratin. That's the comedo, the blackhead.
Ah, the plugged follicle.
Exactly. You also often see some thickening of the very top layer of the skin that's called hyperkeratosis, basically blocked, slightly thickened follicles.
And what about in those more severe cases with the swelling and the pus you mentioned?
Yeah, in those cases, the inflammation ramps up. You see inflammation of the hair follicle itself, that's folliculitis, and inflammation spreading into the tissue around the follicle, parafolliculitis.
Okay, so it's spreading out.
Right. Then you can get pus forming inside the follicle. And if that follicle ruptures, the inflammation in an infection can spill out even deeper into the surrounding tissue. That leads to something called furunculosis and a really intense inflammatory reaction called pyogranulomatous dermatitis.
Wow, sounds like a real battle going on under the skin.
It is. Now, here's a crucial point from the veterinary overview we looked at.
Okay.
While you often find bacteria and sometimes yeast in these inflamed lesions, they are usually thought to be secondary invaders.
Secondary, meaning they aren't the original cause.
Exactly. They're essentially taking advantage of the skin barrier being damaged and inflamed by the underlying acne process. They make things worse, for sure, but they didn't start it.
That's a really important distinction.
It is, although remember the exception. Demodex mites can be a primary cause of lesions that look just like acne. So mites are different in that respect.
Got it. Mites primary, bacteria yeast usually secondary. Okay, so we understand it better now.
Hmm.
What can actually be done to treat it? What helps these poor kitties?
Okay, treatment.
Uh,
Often, the first line of attack involves some straightforward home care.
Like what?
Gently clipping the hair around the chin area can be really helpful. Stuffs the hair trapping debris and medication, keeps it cleaner.
Makes sense.
And applying warm compresses, just a clean cloth soaked in warm water, held gently on the chin for a few minutes a couple of times a day, that can really help to soften up any crusts and make them easier to remove gently.
Okay, simple first steps. Good. What about when that's not enough or for more ongoing issues?
Right. For more persistent or moderate to severe cases, the vet will usually recommend a combination of treatments. The goal is to use these until the lesions clear up.
Combination, okay.
And another key thing is how you stop treatment. Once things look better, you don't just abruptly stop all the medications.
No, why not?
It's generally recommended to taper them off gradually, usually over about 2 or 3 weeks. This helps reduce the chance of the acne immediately flaring back up.
Ah, okay. Easing off it. Good tip. What about those cats you mentioned where it keeps coming back or never really goes away?
Yeah, for cats with recurrent episodes, once you figure out the pattern, like does it flare up every spring or whatever, the vet can work out a tailored maintenance plan, maybe specific cleaning routines or intermittent medication.
A long-term plan.
Exactly. And for those cats with truly persistent, continual acne, well, unfortunately, lifelong maintenance treatment is often the reality to keep it under control.
Okay, so it can be a long haul for some. Let's talk specifics then. What medications are actually in the toolkit for vets treating feline acne? Sounds like there might be quite a few.
There really is a pretty good arsenal, thankfully. And they generally fall into two big categories. Topical treatments, stuff you put directly on the skin.
Right.
And systemic treatments, medications given internally, usually pills or liquids by mouth.
Okay, let's start with the topicals. What kind of creams, shampoos, wipes, that sort of thing?
Medicated shampoos are often a good starting point.
Yeah.
You'll see ingredients like sulfur salicylic acid, maybe benzoyl peroxide, or ethyl lactate, usually used maybe once or twice a week.
Okay, shampoos.
Then there are cleansing agents, liquids or pads with similar ingredients like benzoyl peroxide again, salicylic acid, or sometimes chlorhexidine combined with something called phytosphingosine.
Lots of options there.
Yeah, and for convenience, there are also medicated wet wipes. Really handy for daily or every other day cleaning. They might contain chlorhexidine or formulations like Malaseb, Malacetic, Glyxu, different antiseptic combinations.
Wipes sound easy to use.
They can be. If there's definite secondary infection, the vet might prescribe a topical antibiotic ointment like mupirocin
Buprenorphine.
or other topical antibiotics like clindamycin or erythromycin, which can come as solutions or gels. Sometimes you even see combination products like a gel with both benzoyl peroxide and an antibiotic. Benzomycin is one example.
A two-in-one approach.
Exactly. And in some specific, more stubborn cases, a topical retinoid like Tretinoin gel, you might know it as Retin-A for humans, might be considered, though used carefully in cats.
Wow, okay. Definitely a lot of topical choices.
There is. And one more thing on the topical short-term side. For really severe angry flare-ups, sometimes a short course, maybe just a week or two of an oral steroid, like prednisolone, is used.
A steroid? Why?
Just to quickly knock down that intense inflammation and reduce the risk of scarring while the other treatments start to work. It's usually just a short burst.
Gotcha. Okay, so that covers the stuff you put on the skin. What about the systemic treatments, the pills? When do those come into play?
Systemic meds, given orally, are usually brought in when there's clear evidence of that secondary bacterial infection we talked about, especially if it seems deep, like that furunculosis.
Right, for the infections.
Yep. In those cases, oral antibiotics are needed. Common choices include things like amoxicillin with clavulanate, various cephalosporins, or sometimes fluoroquinolones. The vet chooses based on suspected bacteria and the cat's situation.
Standard antibiotics, basically.
Pretty much, yeah. Now, for really severe chronic or refractory cases, the ones just not responding well to anything else, there are more potent options.
Like what?
Medications like isotretinoin, which people might know as Accutane, can be very effective, but it comes with significant precautions. Yeah, we'll touch on those. Another option for tough inflammatory cases is cyclosporine. The brand name is often Atopica. It modulates the immune response.
Okay, stronger stuff for tough cases.
Exactly. And of course, if the whole problem turned out to be those Demodex mites after all,
Mm,
then the specific treatment would likely be oral ivermectin to kill the mites.
right, target the mites directly. Okay, you mentioned precautions, especially with isotretinoin. Are there other potential downsides or things owners need to be careful about with any of these treatments? Irritation, interactions.
Yes, absolutely. Good point.
Yeah.
With the topicals, some ingredients, while effective, can be irritating. Benzoyl peroxide and salicylic acid, for instance, can definitely cause redness or dryness in some sensitive cats.
So you have to watch for reactions.
Definitely. And some of those medicated wipes might contain alcohol, which can also sting or irritate, especially if the skin is already raw or if used very frequently. And regarding systemic isotretinoin, it's a potent drug. It has known potential side effects in humans, including being dangerous during pregnancy. So it's incredibly important that any isotretinoin dispensed for a pet is clearly labeled for veterinary use only and kept completely separate from human medications to prevent any accidental exposure.
Really crucial safety point there.
Absolutely. And just practically speaking, accessing isotretinoin specifically compounded or packaged for animal patients can sometimes be a bit challenging currently. So availability can be a factor too.
Okay, that's all really important context. So looking long term now, if a cat gets diagnosed with feline acne, what's the general outlook? What kind of follow-up is needed?
The main thing is monitoring. Keep an eye out for any signs of it coming back, any new blackheads, bumps, or redness. Relapses are pretty common.
So stay vigilant.
Yeah. And often establishing a regular, maybe gentle maintenance cleaning routine using those wipes or a mild antiseptic solution maybe once or twice a week, even when things look good, can really help reduce how often it flares up.
Proactive cleaning.
Exactly.
Mm.
It's also worth managing expectations. Many cats with a history of acne will probably always have a few comedones, those little blackheads, on their chin.
Always.
Often, yeah. But frequently, if it's just a few blackheads and no inflammation, no redness, no discomfort, they're just cosmetic. They don't actually need active treatment unless they start getting inflamed again.
Ah, okay, so it's not always about getting the chin perfectly clear forever.
Often not, no. It's more about managing the inflammation and preventing those uncomfortable flare-ups.
Right, managing versus necessarily curing completely in every single case.
That's a good way to put it for feline acne.
Yeah. Okay, fantastic. Let's try and wrap up this deep dive then. For everyone listening, what are the absolute key takeaways about feline acne?
I'd say the main points are, 1, it's really common. You're not alone if you see this. 2, the exact cause is complicated, likely involves multiple factors. 3, there are lots of different treatment options, from simple cleaning to various medications.
Well, there's a range of options.
Definitely. And 4, for many cats, it requires ongoing management and monitoring rather than being a one-time fix.
Absolutely. And I think the big message is if you have noticed those little black specks or any redness or bumps on your cat's chin, don't just ignore it or assume what it is.
Please don't, yeah.
Have that chat with your veterinarian. Getting the right diagnosis first is so crucial to figuring out the best way forward. And even though it can look kind of yucky or worrying,
It can look quite alarming sometimes.
it's good to know that there are usually really effective ways to manage it and keep your cat comfortable and happy.
Definitely. Which, actually brings up an interesting final thought for you, the listener, to chew on.
Oh, go on.
Well, given everything we've talked about, all those potential contributing factors from skin keratin production, grooming, sebum, maybe even stress, what sort of things in your cat's environment, or maybe their daily routine, could potentially be tweaked? Always talking to your vet first, of course. But what small changes might help support their overall skin health, maybe making them less prone to these kinds of issues in the first place?
Yeah.
Just something to consider, perhaps.